When it comes to the brain, it is very much a chiropractic conversation in regards to concussion. After all, the brain is the master controller. We all know the upper cervical spine is still considered the brain stem. So when someone is concussed, it absolutely has a global effect on the body. Now, if you want to get into the sports science of this, there's a 3.7 times greater likelihood an athlete who is post concussion will then have an ACL tear. So almost 4 times greater likelihood that after a head trauma, there creates an ACL tear, which for many athletes is a career ender or definitely changes their athletic abilities. Now, the reason this topic is so key for us is the information most often needed is preseason. So we're going to be doing our Concussion Roulette online virtual learning opportunity. It's a masterclass. And if you understand that getting to athletes preseason to do a wellness checkup, a pre-concussion protocol will then help you in any questions of concussion. For that reason, we've had full teams come into my practice as new patients. We've attracted performance new patients into my practice, not just pain based. So this isn't a theory. We've actually done this. We've worked out the kinks. And what I can offer you is an online faculty that is world class. We've got people like Deed Harrison, James Chestnut, Dr. Scott Rosa talking about the upper cervical spine specifically, as well as doctors of physical therapy helping us through the rehab. I teach the marketing and how to do this to pull people into your practice, because in a short 10-minute talk, you can absolutely attract preseason athletes to get a baseline test that you will then check them against if in fact there's a problem. In the process of doing the baseline test, you can also educate them on the subluxation, spinal health, and what it is that you do in your practice. Maybe most importantly, cleaning up old injuries before they start the season. Look, it's a win-win. The athletes get the information ahead of time, you get a practice full of new patients, and we are doing this in a way that you don't need to travel. The only unfortunate thing is we used to do this symposium, the Concussion Roulette online series, as a live seminar here in the Rose Bowl. So I'm standing here in the stands at the granddaddy of them all, and I'm sorry to say we will not be doing this as a live event. But as teams are playing again and people are getting back to a regular routine, it's time to roll this program back out. Concussion Roulette, it's a masterclass. It's all online. It's a virtual opportunity to watch the content 2 and 3 times if you want to. The marketing is included, the science, the recovery, everything you need to make you an expert in your community for performance-based new patients, for helping people through what could be a career ender, and then they will thank you as their chiropractor. So again, after a brain concussion, 3.7 times greater likelihood of an ACL tear. They've even done studies on lower performing academics for children. There's a plethora of reasons why parents are going to want their children in your practice to get chiropractic care first. There's no pill or drug that's speeding up the brain healing process. It needs to be a natural process. It needs to be a chiropractic conversation. Hey, I'll see you online, Concussion Roulette. It's a masterclass unlike anything else. And the faculty, it's world class. We'll see you there.